Um, Hello, everyone. We now have 12 participants and we are very good to go. Glad to have you today in this webinar of how to start initiatives as well as NGOs. So I'm very glad that you made it on time and I think you're just good to go. Starting by introducing myself, I think you now know me since I've been having so many webinars to host. My names are Yvette Nkurunziza. I am a medical doctor from Rwanda. Currently, I am studying my master's in global health delivery at the University of Global Health Equity. I am a WMI graduate scholar. I graduated in August 2022, supported by WMI. I am glad that we are here today in this very good webinar that we are starting now of how to start an NGO and a community initiative. Actually, in February 2023, that is when our board has been introduced. The WMI introduced the Medical Scholar Board because you know well that we are many WMI scholars who are from medical background, nursing background, physiotherapy, pharmacy, and all the others. And they thought that it is good that we interact, that we share experiences, that we share our views through three main roads. Mine is mainly the medical experience share, where I'm in charge of hosting webinars like this, where we share our experiences, where we learn from each other, and we interact as well. And then there is also my co-workmate, if I can say, who is also in charge of now networking sessions, like to help us know each other. I'm thinking that you are all in the WhatsApp groups now, and we have already been interacting. That was one of the initiatives as well. And I think we also started doing the DBC in Kenya last August. And another one, we've been now seeing emails with opportunities that Mori is also in charge of. And we are glad that some have already started benefiting from that. So we are now happy to be with you today. So if you can hear me, say just hi in the comments so that I can actually get you. So starting with a webinar now, we know well that we have some WMI graduate scholars who already now started NGOs, who started initiative. So I'm with Mugabo, Eric Mugabo. I don't know whether you can hear me, and Catherine. Mugabo has the Oasis Health, and Catherine has the One Girl Unstoppable. They're going to take us through all these, explaining us what they do and everything. But please make me see that you're here. Are you there? Okay, I can see people in the chat saying hi as well. I see you, Catherine. Wow. Catherine Nagadia is with us today. We are excited to listen from you today. We have David Joseph. We have Bedang Getudwell. Please excuse me if I'm not pronouncing your name quite well. We have Ayaja Simo Enoch. We have Betty, and we have Anyanja Simeon Enoch. We have Onezai, who is also part of the board. We have Chris, we have Kamara, we have Thomas, and we have Sar Faila. So glad to have you today. We can now go on with our webinar without further ado, because it's only for 1 hour. If you have questions, I advise you to type them in the comments so that we interact with our panelists afterwards, after they've already given us what they've actually prepared from us. So we are welcome all and glad to be with you today. So Eric Mugabo, can you hear me?
Yes, Yvette, I can hear you very well, but from my end it is raining. You may hear some background noise, but I try to mute as much as I can.
We see you very well. We see you very well with the Oasis Health. We can't
okay, thank you.
After inspired us today. So, Eric Mugabo, I wanted to ask you, what are the benefits of having an organization or a community initiative? Is there something that we have to lose our time towards? So what can you tell us as a community impact? Any growth has it brought to you? Any growth that Oasis Health has benefited to the community? And first, what is Oasis Health, by the way? So we also have to explain like what it is, your journey, and everything. We just want to give you like 8 minutes particular to you to take us through this and help us know more about you. You're welcome, Eric.
Okay, thank you so much. As I said, from my end, it is raining. You may hear some background noise, but I hope you can catch my sound very well. And I'm glad to be with with you all in this webinar where we talk about how to start an NGO, different aspects of having an NGO. Is it impactful? Is it something that we can lose if we don't start an NGO or a community initiative? So I believe that we'll dig deeper through this topic together. Yvette asked me a very big question. I will start by introducing myself and then dive into the question as well. I'm by names of Dr. Eric Mugabo. I'm a medical doctor, graduated in 2020 from the University of Rwanda. And currently I'm pursuing a Master's of Public Health, specifically in epidemiology, disease prevention, and control. He asked me what is Oasis Health. Oasis Health is a non-governmental organization, youth-led, that aims at extending access to health services and information to Rwandans through digital, innovative, and cost-effective solution. In short, that's what I can say, that's how I can define Oasis. And tackling the question exactly that asked me if having an NGO has a given impact is something that everyone should wish to do or should wish to have. I can say yes, because having a community impact-oriented organization or an NGO has several impacts that everyone would wish to have for himself, even for the community. Let me start by impact that having an NGO can have to the community. Mostly, even specifically speaking for graduates and the ongoing WMI scholar, commonly we come from some backgrounds and families and communities that really need such community intervention to address specific health threats that are happening, that are ongoing in our communities. So tackling the impact of having an NGO by starting from the community impact or the community benefits. If you are a scholar of WMI or someone educated from your community, having an NGO can be your best way to give back to your community, can be the best way to bring impact to your community. Having an NGO will enable you to work and to tackle on community health problems, even other social problems that are identified in your community. For example, there can be malnutrition, there can be unintended pregnancies. You can tackle them as a volunteer in other organizations, but when you have your organization specifically, you can be able to design and implement solutions tackling such problems, and this will bring you a very good platform for you to impact your community. Coming back to you as a person, as an individual, having an organization or an NGO is very beneficial to you. I can say by giving examples to me, because when you have an NGO or an organization, it gives yourself personal growth opportunities. When you start something by you, you become a reader, you become responsible, you become someone who have something that you need to monitor, that you need to maintain, that you need to learn on a daily basis. And this comes with responsibilities that makes you a mature person, that makes you more accountable to specific things. It is a very good leadership experience because you can't have an NGO alone. You need to have a team. And then when you are the one to start the NGO, it means that you have a a given number of people. Maybe you can start a number of 3 or 5, and then when you are the head, so you are responsible to them, to lead them, to give them a mission and a vision, and then try to.
We missed you, Mugabo. We missed you, Mugabo. Oh, let me see, let me see. As we wait for Mugabo to be with us, because his place is actually raining and he's having issues with the internet connection, maybe I can move to Catherine. Catherine, are you with us? Catherine?
Yes, I am. Hi. Do you
Yes,
hear me?
so yes, we hear you, Catherine. Thank you so much for joining us, and we see you very well.
For having me.
Yes, maybe we can give you some time to first present about yourself. What is your initiative about? Why menstrual hygiene? Because I know it's more of menstrual hygiene. Like, present about yourself and tell us a bit about your NGO.
Thank you so much, Dr. Yvette. It's a great opportunity to be on this webinar. Thank you for having me. I'm Dr. Nagadia Catherine. I am WMI Scholar of 2012. Yes, I have an MBCHB that I obtained in 2015, and I have a Master's of Medicine in General Surgery that I obtained in 2021, and a fellowship in minimal access surgery. I am currently a COSEXA scholar pursuing a fellowship in upper GI and endoscopy surgery that I started in 2022. However, for the purpose of this webinar, I am going to share about Girls Unstoppable Uganda, which is an initiative that I started in 2016. I am the CEO and founder, and I started this organization as a way of giving back the gift of education that I received from Wales Mountain Initiative. So basically, what we do is we support the education of girls who are not able to go to school, and we do this by providing them with scholarships, with scholastic materials, menstrual hygiene materials, but also with holistic support, which includes some form of mentorship and skills training. That is what we do. So we've been doing this since 2016, and we have so far given out 49 scholarships. We've had one pads distribution to schools in villages, and also one distribution for books to set up a village library. That is what we have done so far. So your question of what are the benefits of having a community initiative. To start off, I would want to share a scripture from Luke chapter 6, verses 38. It says, "Give, and it will be given to you. Good measure, pressed down, shaken together, and running over, will be put into your bosom. For with the same measure that you use, it will be measured back to you." When I was sharing about how Girls Unstoppable Uganda started, I shared that I started this as a way of giving back the gift of education that I received from Wales Mountain Initiative. And the thing that we do with community initiatives is we solve problems in the community. And usually this can be something you do maybe as a full-time job, or it can actually be something that you do, as a side alongside another job. For example, I am a general surgeon, but I do Girls Unstoppable work. I support the education of these girls by doing those different things. And the thing is, as you're solving the needs of the community, one of the things that you are doing is actually you're contributing to social change. And I think there is absolutely nothing that you can replace with that. Being able to be a part of something that is bigger than yourself, being able to see transformation happen in the lives of people in your community as you solve these different needs in the community. But also, when you're part of an initiative, in a way you belong better to community. And when you belong better to community, you foster a sense of belonging as an individual. And that is very important for us, especially in the African setting where we are really so much about community and so much about family. But also you have an opportunity to foster collaboration with different people in the community, different people in the nation, different people in provinces and districts, because there is something that can kind of join the two of you or a group of other people. People are able to come alongside you because there is something, there is a purpose and something that you're solving. And a thing that I have actually benefited ever since I joined, I started Girls Unstoppable Uganda, is that it has fostered for me social connections. There has been a growth of social capital beyond the walls of the hospital where I work every day. Yeah, because now I get an opportunity to get into community, meet people, visit these girls, for example, be able to go to the schools where they study. And that has grown my social capital so much beyond patients and beyond colleagues at work, because the kind of work that some of us do is really seeing patients who in most cases will not become your friends, and then colleagues. And because the environments we work in are kind of sad, sometimes they are toxic, usually, especially for us surgeons, the people that you see are nurses, your anesthetists, who usually don't like you because, of the kind of work that you're giving them. So you may not have very many friends coming in from your workspace, yeah? And when you come home and you're really exhausted, you may not even have a very thriving family life, yeah? So being part of a community initiative allows you to grow your social capital, but also it allows you to be part of things that are progressive and things that are contributing to the growth of community beyond your workspace, beyond what they are paying for. Lastly, one of my teachers told me that there can be so many surgeons, like there are so many surgeons in Uganda, for example, and these very many surgeons are actually good with their skills. Like, people are always improving and improving, progressively improving. Some of these guys are innovating products, yeah? And he said that the thing that is very special about me is the fact that I'm doing something outside of surgery. So when you're doing anything outside of your usual work, yeah, you have something that is additional, like you become different. And in a way it gives you a greater purpose, but also it sets you apart, yeah? Because there was a time that they were profiling female surgeons that are below 40 years, and I was among the people that were profiled. But also they've been running mentorship series in the Association of Surgeons for Uganda, for example, and I was honored to be, a mentor on those series. And I happen to be the youngest mentor who has ever been hosted on those series, because I started Girls Unstoppable Uganda, and it is doing work that is, doing something different outside of surgery. So such an opportunity I could have never afforded. I wouldn't have been the youngest mentor on those series, because the people we are hosting are people, who are like professors. They have done a lot of research, people who are like heads of departments who have been around for a long time, people who have done thriving businesses, but I was able to feature on those series. I was able to feature in 40 women under 40, surgeons under 40 who are doing something incredible because of the work that I've done with Girls Unstoppable Uganda. And yet I believe I am a good surgeon, but nobody has, written anything about me because I am a surgeon working somewhere, because everybody who is a surgeon is expected to do surgery work. So community work allows you to have this extra thing that you're able to give people beyond what the people are giving you. I would love to leave with this quote from Martin Luther King Jr. He said that everyone can be great because everyone can serve. The work that we
Repeat
do in
again.
community. It
Everyone
says
can.
everyone can be great because everyone can serve. But also it is in the Bible. Jesus, I think, was telling the disciples, and he told them that whoever wants to be the greatest among you should serve. Yeah, at that point when he was washing the feet of the disciples. And that is the truth. The kind of professional life that we live, there is a limit to the kind of greatness that you can achieve. But when you get down into community and you serve the needs of people, you have such a wonderful, wonderful, great opportunity for you to actually end up being great in having impacted the lives of very many people, because these people whose problems you're solving, they will never pay you back. The people that we serve in our professional lives are people who can afford to pay us. Either the government pays for their services, or actually they pay you if you're in private practice. But when you do community work, people will never be able to pay you. The people whose school fees we are paying as Girls Unstoppable Uganda, they can never pay us back. The best they can do is, say thank you and God bless you. And trust me, those blessings are, they like those words of thank you from someone who can't pay you back. I can't really, put an amount and a price to it. Thank you, Yvette.
Oh my God, everyone can be great because everyone can serve. I'm just liking the female surgeon who challenged herself to also make other girls study. Actually, that is a very good thing that you can learn. I love the Christianity side, but since you can maybe not all be Christians here, I can say that whenever you're not a Christian, but you know that maybe doing good is okay. Like doing good is positive, right? So challenge me in the comments if I'm lying. If there's someone who agrees that maybe doing good is not okay. And the fact that Catherine liked to give back to the community, like recognizing how she has also been supported by WMI and thinking how it can actually grow, it is also a good thing. And I remember he also emphasized that there is a social capital. You can live well, but you need friends who are going to be from your initiatives, for example. You need to have a sense of belonging. I don't know if there is someone here who don't belong anywhere. I'm not the one, by the way. I don't know, maybe you can also tell us how you think this, but knowing that, yes, I'm from the hospital work, but where else do I belong? If she's a surgeon and now being part of the COSESCA with her GIT surgery studies now, why can't you also challenge to take some time towards that? Even I think WMI encourages us to do so. WMI doesn't need us to only study. It also encourages us to go in our communities and impact in the, we have to give, for example, reports that are impacting the community. So having that sense of belonging is also quite side, building that friendship, social capital, which are more important. But Catherine, there is something that I need from you guys, even Mugabo, after you. We know well that you cannot start, for example, for one day, and you think I'm going to start Girls Unstoppable Uganda in just one day. There is a journey you went through. Maybe supported one, and now it's 49. So, yeah, and I liked the opportunities that have brought to you, like being at a higher panel when you're still young, because of the community initiative that was actually impactful and everyone was actually seeing. That was quite good. But I want your journey. Like, you didn't, for example, wake up and support 49 girls. How have you started? Like, the idea came, but what is the journey that you went through? Like, how did you start? How did you manage to get the sponsors? Like, we want to inspire you to inspire us, like the starting journey, because someone can be challenged here and say, for example, I'm a graduate. How can I start? I don't have anything. So maybe like, how did you start, and to see whether you can also root into that, to start in the same way, maybe, or to start small. We want to see how you started, because 49 is a big number and can't be supported in just one day. Welcome, Catherine.
Thank you so much, Yvette. That is a very wonderful question. So I got the WMI scholarship in 2012. And at that time, I was about to drop out of school. So it was such a big miracle. I was like, you know what? If someone who doesn't know me has done this for me, I would really love to do this for another person. And at that time, I desired to just do that for one girl from my village. Actually, I even knew that girl. The girl was, there was this young girl who used to look up to me. I was about like 10 years older than her. You know, she liked me so much. She would talk about me. So initially, I used to like give her my clothes that I've outgrown, and their family was poor. So I decided, I purposed that when I get out of school, I would actually sponsor the education of this girl so that, you know, she continues to be like me, really. So in 2012, I got the WMI scholarship, and I was like, you know what, I really need to do this. And I graduated in 2015. My graduation was in January 2020. Sorry, I graduated in 2015, but my graduation party was in January 2016. And at that party, I told my sister about this dream that I had of supporting the education of one girl. And when I told her, she asked me so many questions, and I realized that I had never really thought through this idea. She asked me about, you know, do you know how expensive education is? For how long do you want to support this girl? Where are you going to get the finances from? Etc., etc. And initially, it felt like she was trying to water down my idea. But as she asked me these questions, I realized that I hadn't actually thought through. I hadn't considered the fact that education is very, very expensive. And actually, it goes on for so long, because if you're to support anyone in Uganda, for example, there are 7 years of primary school, 6 years of secondary school, and they can even be 5 years if, for example, they are doing medicine. So it's a very, very long time. And currently it costs about $300, you know, minimum for anyone to go to school every term. So it is quite expensive, and we have 3 academic terms. That is quite expensive. I hadn't considered all those things. So of course I answered back, there was an argument, etc, etc. But when I went back for my internship, I continued thinking about this idea. And the more I thought about this idea, the more I started, you know, figuring out the answers to some of the questions that she had asked me. And so for the remaining part of my internship, I started saving money, because now I understood it is quite expensive, and nobody was going to just give me money, because even at that time when I was about to drop out of medical school, there were no people to give me that money to continue with school. So it was quite clear that I wouldn't just walk up to anyone and they give me the money. So I saved some money. And the more I talked about this idea, the more I realized, okay, some people were like, oh, actually, that is a very good thing. We can actually come alongside you. But for people to come alongside you, you have to have something that is legal and standing, yeah? Something that can be binding, something that is beyond of yourself, something that they can hold accountable to. And that is how Girls Unstoppable Uganda was born, from those interactions with people and sharing about this idea. I realized that, you know what, if I want other people to come alongside me, I can't just do one person. Yeah, one person is too small to call on other people to actually support you. So initially, when we set out as Girls Unstoppable Uganda, we were about 5 co-founders, and every one of us was supposed, I think, to donate $50. Are supposed to give 100 because as the vision bearer, and we are supposed to support the education of 4 girls every year, 4 additional girls. That was the dream. So when we went out to look for the first person, because at this person, it was no longer that girl that I wanted to sponsor, but now it was open for other people to compete for this opportunity. But we gave the opportunity to people in my hometown. And people applied, received about 20 applications from the girls in that community. And we went through the applications, we went through their reports, and people had very, very poor grades. And one of the things that was important on our screening list was actually someone should have good grades. So we ended up giving one scholarship to a girl from my hometown. That is how we started. But also, the co-founders never sent in any money. So when it was time to take this girl to school, yeah, people didn't come through. People didn't come through. And yet I had used some of the savings from my internship allowance to, register the organization, run around, that bureaucracy when you're beginning something, hold meetings, do the home visits. It had been a lot of work. So I ended up, using personal money to send this girl to school, but also because this girl was coming from a poor school, we had to transfer her to a better school and in boarding. So we had to buy for her beddings and things like that. And when it was time to take her to school, my father had to actually drive this girl to that new school. So that is the thing, like you have to utilize the resources around you. Speak to families. Sometimes it might be, your old clothes that you give. If you're, for example, giving a drive, it could be sharing your food. It could even be housing these people in your home as compared to renting a place. It could be having the office at your place. Things like that. Like you have to use what you have, but you definitely have to start. And you don't have to start with that big dream. You just have to start somewhere. So we started with one girl. So we went through the first year, and this particular girl, when she went to this new school, she found a lot of pressure, and she couldn't cope up because the school was better. It was in town. She couldn't cope up, and she requested to go back to her village school. And we told her, you know what, if you're going back to a bad school, we will not be able to sponsor you. So we ended up, not paying for her entirely because, she couldn't meet our needs. So we went on to year 2. At this time, it was me and my sister who were contributing to the organization. In year 2, when it was time for, do we onboard, do we not onboard? The money is not coming through. Where is the money going to come from? It was tough. And at that time, I was working at a health center. And in this health center, we had one of the ladies who used to help us cook. So exams come back for primary living examinations, and her daughter had scored so highly from a village school, but she couldn't afford to take her to secondary school. So this girl used to come around in holiday and help. And so I had, heard about her, and she would cry for the mother. Every day she would cry for the mother. And every time I would meet her mom, I would find her mom crying. So I kept asking her, why are you crying? And she told me, I'm crying because my daughter keeps crying because she can't go to secondary school. And that is how we actually got our second beneficiary. I spoke to my sister, and they're like, you know what, there is this girl who is crying every day because, she can't enroll. I know people didn't come through, but let's take her on. So we took her on like that. But also there was another girl who had come from a village to work at Alinga Bonnie Mac's home as a maid so that she can save up some money and enroll. So that's how we ended up getting our two beneficiaries for the second year. And I'm happy to report that these girls are now in senior 5, so we've had them for 5 consecutive years. Yeah, and they have been performing so well. So it's been amazing. So in the third year, we did 4 additional 4, then 6. And in 2022, we did the highest number. We did 22. Then last year, we did an additional 13. So it's been leaps of faith. Like there's been no season where money has been available. We've just kept pushing and pushing and pushing our faith. And it's tough because I can share that last year, in our second term, we actually didn't have money for paying school fees. Like there was no money. And when we were drawing our budget, we had about 70% of that money projected to come from donations. Yeah. So we were sure money would come through because people have been consecutively signing up. Currently, we have people who give as low as 10K. 10K is about $3 every month. So we have made it so cheap for people to contribute to the cause. But people still, the $3 didn't come. Like people signed up and people didn't give you the money. And about 20 was projected to come from our income generating activity. We make soap, hand sanitizer and things like that that we save. And then we anticipated 10% to come from grants that would, write and things like that. The money didn't come. We paid for first term, and second term we didn't have money. I had sleepless nights, you people. I had sleepless nights and I was pregnant. It was tough. It was really, really tough. And I was recently married, so some pressure on my husband. It was tough, but I know you said that some people are not believers, but I'm a believer. We kept, praying about this, and we had money coming through. We actually were able to raise about 7,000 USD in a span of like 1 week from only two people. Money came through and we were able to pay school fees for the girls. So when you start your initiative, honestly, it will initially be your own money. It might be support from family, and you will utilize a lot of the resources you have. It could be your home space. You will donate your computer to the organization, you donate your phone, you start donating your food. You will empty of yourself, yeah? But as people see your consistency, as people start seeing the fruits, people will start signing up and being easy giving you money, yeah? But they only do that when they have seen your consistency and the results. And remember, when you're starting, you absolutely have nothing. Mostly you may just have passion, and no one wants to fund just passion. So people will require some results of you. And so that journey will be painful and long. Even currently, it is still painful because currently we are running a fundraiser. Our budget for school fees is 20 million per term, yeah, minimum. And that is without the new scholars that we desire to onboard. So it will be painful. Like getting money out of people is tough. It is different if your organization has been birthed out of a grant opportunity. That is different. But the work that I do, where people have to continuously give you money, it's kind of tough, especially in our economy. So that has been our journey thus far, and it is still tough, but yeah, we are hanging in there and seeing some fruit. Yeah.
Oh, Catherine, I just like the consistency. I was wondering if I couldn't have given up when I started crying all the nights, wondering where the school fees are. But I don't know whether Mugabo can hear me. Mugabo, can you hear me?
Yes, Yvette, I can hear you.
Yes, Mugabo, you were taking us through the benefits as well, but you also
Yeah,
wanted to know now the journey of Oasis Health, just like a summary, because you have to catch up with time. For you,
yeah.
I think it's a grand thing. There were no problems. That is what I was expecting. So the floor is yours. 3 minutes.
Yeah, yeah, thank you so much. Actually, the journey of Catherine is so interesting, and her persistence and consistency should be very, very appreciated, and the impact as well that she's making in Uganda. I'm glad to hear about your work, Catherine. Yeah, for me, Oasis, as Yvette said, it is not that tough to as the Catherine journey, but for me, I can start this way. Also, WMI has been like the source of my dreams because I reached in university in 2016. So I was facing several financial hardships until I get granted WMI scholarship that founded me. And through several emails, through several talks with WMI staffs, you can see that they always encourage us to find a way to give back to the community through volunteerism, through performing some activities and organizations. But for me, I had an idea, why can't I foster a place where I can volunteer myself, get the volunteering experience, get a way to give back to the community. And I had a lot of ideas in my mind because I saw the community has a lot of things that need to be addressed. But I started to conclude that I need to do something that is in my career. As I was doing medicine, I said that let me find a way to build an organization that will facilitate the delivery of health services and information to the population so that they can have improved well-being. That was in 2018 after being granted the WMI scholarship, but it was just an idea. I didn't have anywhere to start. I had the idea for myself almost around a year, but when I realized that I cannot launch the idea alone, in 2019, the starting of 2019, I approached other fellow healthcare provider students. I introduced them my idea that I want to start an organization, and they were, "Are you mad, guy?" Because we see organizations are big things. Those were my friends who used to go with me in volunteering activities in community outreaches, and we say that they came to discourage me, telling me that, you see, we are able to volunteer, we are able to participate in several activities, but it is very tough for us as year 3 students of medicine, pharmacy, and nursing to start something as an organization. Where will you get money? What really are you going to do actually? So we kept our dreams sleeping. Until 2020. In 2020, that's when the first case of COVID came in Rwanda, and it was around March, and then campuses were closed. We went back home, and then we were sleeping at home, doing nothing, no classes, and no nothing. Keeping thinking on my idea, and I was reading an article on misinformation about COVID-19. I say this might be my biggest opportunity to launch. And I said, how am I going to launch? I said, as I see, my idea is to facilitate delivery of healthcare information and services. Maybe COVID is my best opportunity to provide accurate information about COVID-19. The way I launched it is amazing, and it's funny because my very first activity that makes the organization live was the Twitter account. I didn't have any money, I didn't have anything, just my data on my phone and an email. I created an account, and then I started designing posters. You know, I was not a designer. I didn't have some design skills. I didn't have a designing officer or IT officer, but with my computer and my phone, I started creating an organization. I started leading websites of CDC, WHO, and summarize the information about COVID, and then I post them. Please wear mask in like some facts around COVID. That's how I started. And after joining Twitter, I come across several people who get interested in my work. Oh, Kai, you are doing great. The very first man that I met is a UK lecturer who is interested in antimicrobial resistance. From Twitter, I secured my very first partnership. And then our very first project on antimicrobial resistance was launched, and it was about educating Rwandan youth on antimicrobial resistance through an online course called Antimicrobials and You. So we designed a campaign, and then we mobilized a lot of people, around 300 people took the course online. And I say, oh, things can be doable, things are possible. So after that, I see, okay, I'm now a live organization with no registration something, but I said, let us have a website, and my teammates started to see that things can go through, things can happen. We created a website, and then from there, we started looking for grants, and up now we have secured almost 4 grants. 2 in antimicrobial resistance, 1 in breast cancer awareness, another in family planning. There is an interesting family planning method that is novel called Cyana Plus that is self-injectable. Like a woman can self-inject an hormone, and then it can protect her from pregnancy for 3 months. So I can say that the journey has been rewarding, and the journey is now kinda soft and good because people has come to believe in our work, and they are joining hands with us. Even the team is now engaged and interested. So I started as one with the idea. I introduced the idea to the team. The team was previously firstly not motivated, but by now you can see that they are all engaged, and the team is growing as well. We are now a team of 6, and we are very happy for that. Though the mission and the vision is not yet realized, we still have a lot of way to go, but we hope that with the help of other people, with like-minded organization, we will lead further, and our impact that we want to deliver to the community will be realized. Thank you.
Oh my God, I'm very much impressed. Just catching yourself in the middle of a disaster like COVID, some of us were actually sleeping at home. Am I lying? But some people have just secured grants from there. They have already challenged themselves. Isn't this really amazing? Just in the middle of the disaster, in the middle of your depression, when the schools are actually off, and now you are impacting the community, and you're winning grants, by the way. I just heard grants here. Which is quite interesting. So you see, the approach of Mugabo is a bit different with Catherine. Catherine is more of a charitable work, while Mugabo is more of an NGO, like working for himself, which is actually also good. And remember, on the benefits that has told us that has benefited, there was a personal growth, team working, as well as the grants. So, adding to what Mugabo has actually said, he forgot an interesting thing called mentorship. Because he is mentoring so many things, including me. I remember when I and my team were writing the WMI seed grant for the Awaken Her initiative that I'm also trying to build about cervical cancer awareness. He has helped me for that because he's now used with writing grant proposal. You can give him a grant proposal and it's like, for you did nothing, because for him it's super perfect because he has got that experience and everything. And he has also helped us win the deep prize grant as well, because he has showed us how to write grant proposals, reviewing. So I can mention that despite the community impact and his personal growth, but he's also mentoring so many other people to get back into the game, including me. So I want that everyone who has a question can start typing in the comment, because we are just remaining with a few minutes, so you can start writing your questions. But in the meantime, I wanted to ask Mugabo, when he's still with us, not having the internet disturbance with the rainy thing. So, can you advise someone to rely on an NGO only, or maybe you can do an NGO and then do the side work? Because NGO is more of a challenging thing, securing that you're going to be having a salary every month. It was actually a question addressed to Catherine, but I think Mugabo is in a big context to answer that, since for him it is an NGO. Like can you advise someone to have only an NGO, or an NGO maybe with a work, so that to be financially stable? Because there's some people who can fear, like, what if I go for an NGO and I'm not able to survive? What if I miss the grants? How can I survive? So like the big challenge that you can actually take, like what would be your advice as someone who has already 5 years into this? Take us through that.
Okay, thank you so much, Yvette. I also want to mention someone called Victorina Napeyeko. I'm glad to see that some people here are benefiting from the work of Oasis Health. She texted in the chatbot, "Thank you, Mugabo. Last year, I pursued a short online course on application of AI in healthcare. It was amazing. I got a lot of specialty medicine." So this is amazing, and I'm glad that we have also an online educational platform for healthcare providers, and this is one who enjoyed the one of the courses. So I'm glad. Thank you for the message, Victorina. Coming to the question that you said, Yvette, is can one rely only on an NGO? It's like to make yourself full-time committed to NGO. I cannot differentiate this as starting a business because they are both risky ways, and it is a very hard decision to take because it is not a tic-tac process. You don't go and said, I will win grants. You may get grants and you may not get grants. And some grants, they are not able to facilitation to the staff. You know, there is that thing of overhead expenses. Some grant funders may say, please, all the money needs to go to the project activities, and at that time, the staff will not be facilitated. So having an NGO, it requires a lot of money because you have to find the money to sustain the project. You have to find money to sustain the staff. You have to find money to sustain the office and the other expenses that you need to give or to spend on a daily basis. And to have that decision to decide to work for yourself in an NGO, it is a possible way, but it is a risky way. And many people, as me as well, don't just shift from government work to NGO work. They prefer to work with them bilaterally for some period of years. And when you see that one is sustainable, is able to sustain the community initiatives, and then you can also sustain yourself in kind of rewarding way of salary, you can now shift to the NGO, and then you employ yourself as a full-time employee to the NGO. But when you graduate, you may even start immediately to work for yourself as a full-time officer or full-time staff to your NGO. But depending on your journey, it may take you maybe 3 to 4 years so that you can start earning some salary. So you need to be committed to that. And but the best way that I can advise people is to do them bilaterally, because there is a mutual benefit in this. When you have something on side and you have another kind of employment, it is very good for you. As Catherine said, you don't have any money, but you need to pass all the bureaucracy things so that you get registered. Getting registered doesn't cost free in some countries. There are some fees associated to that. How will you get that money? So it is better that you have a side hustle that can give you some money to sustain your work. You don't have to shift immediately to the NGO things when you don't have money exactly, because you'll finally find yourself failing. If you don't have internet, you don't have money to go to meetings, you don't have money to build your website, so you'll finally fail. So I prefer that you have something that fund your NGO until your NGO can fund you so that you can shift to the NGO. Thank you.
Thank you very much. I just said that due to the process, you can just be taking both, so that you don't suffer from malnutrition or even hunger. Yeah. Yes, yeah, great ideas mentioned. Or just scrolling through the charts, Maury. Yes, you can get some guidance from me and Mugabo about the price, because you want it. There's someone also asking us to follow Blue Witch Health Inc. It's an initiative of Anyatro, so I think we can all follow it as a way to support him. This is WMI, this is a family. So he's asking us to follow it, and let's do so. There's also another question, but before I tell Mugabo to answer the question, because it's more of the sources where you can find the grant application, I want to go back to Catherine. Catherine, can you hear me?
Yes, I can hear you.
So I wanted to ask whether university students can also challenge themselves to do such a work, or if they can just wait until they graduate, maybe to go into this. So do you advise also students who are also with us today to also try their best to do this, or they wait, they turn when they finish school? What do you advise now that most of them, they are from medical career, they're from which are more time consuming, you know, nursing, pharmacy, physiotherapy, medicine, these are a bit confusing. So what is your advice to students?
Thank you so much, Yvette. It's a yes and no, and I'm going to expound on both. The kind of work that Eric is doing, which is funded by grants, I believe there is a lot of opportunity, especially in universities, for you to win grants. So you're able to fund the work that you're doing. And it is also easier when you're doing an initiative that is in your line of work, like something that is more of like what you're studying. So for example, what Eric is doing, something in health, and you're doing a health related course. It can even be like research, you know, and it ends up bursting into an application that can be applied to community. So it becomes easier for you, but it is different if you're crossing over For example, you're a medical student and you're doing Girls Unstoppable work. It might be quite challenging, you having to do fundraising, home visits, visiting with schools, a lot of networking events for you to be able to get donors. It might be quite challenging. So it is yes, you have to weigh both. But one thing is for sure, just having passion, being passionate about your idea is not enough. Do not do anything because you're passionate about it. It is important for you to be passionate about the work that you're doing. But like Eric has said, just like I have shared, there is a lot of work. So you being passionate will not be enough. You have to do a lot of networking. You may have to undertake a lot of personal growth projects for you to be able to deliver, because usually when you're a founder, you end up wearing very many hats. Yeah, you're the founder, you're the accountant, you're the field worker, you're the monitoring and evaluation person, you're the one writing the project proposal, you're the one implementing it, you're the one providing accountability. So you may not have as much time as a medical student for you to be able to deliver on that. Yeah, so the scope of work will have to limit you in a way, but it is not absolutely no that you can't do the work. Some initiatives are things that you're able to do. For example, when I was in my medical school as an undergraduate, we went for community placement, and we ended up doing a project to address malnutrition. We ended up developing a formula using local foods for us to combat that. If I was into public health and nutrition, that is something that I would have, done for the long haul, because, it is a solution that helped. And there is a lot of malnutrition in Uganda anyway. It is something that I would have pursued long term, but I didn't, because, my passion wasn't there. So there was an opportunity there to address a community need. And I know as you're in medical school, as you're doing your physiotherapy work, there will be so many opportunities for you to address community needs. And this is what these initiatives are about. You identify a need, you get a solution, look for resources, and address it. And by the way, you don't have to do it for 5 years, 10 years, 40 years. You can do it for a year. You can have initiatives that last a year. I'm very sure some of the projects that Eric is implementing are not lasting 5 years. You can mean to shift from one project to another. In your organization, you don't have to have an organization that just addresses one thing. You can always shift here. So you can actually do it, but you have to be cognizant of the effort that you have to put in and the resources that you will need, especially when you're in medical school. Thank you.
Thank you very much, Catherine. What I understood is that we are not late to start. Whether you're a student here, you can start with your resources you can have. Maybe what you're studying can be an opportunity. This is what Catherine told us. So just look around, try to be proactive, and try to see what you can do. I also remember when I was still a medical student, in the COVID-19 pandemic, the WMI also had these grants for people who want to do initiatives. And then as a student who also in COVID, I managed to provide portable hand washing stations in remote areas and refugee camps as well. And on that, I also won the pollination grant to do the same project, because I was showing that I did few and I can maybe get more. So it means even as a student, you can do something which can add to your CV. You never know what comes next. You remember, this is more of personal growth and can actually impact in the future. So now, I'm not sure. My mandate is actually ending. I would have hosted another webinar on now how to write grant proposals, how to make it look fine, but maybe it's a recommendation that I will give to someone who is going to replace me. Maybe you can also come, because the release will be in February. But as of now, let Mugabo share with us the sources where we can find these grants, application opportunity. Catherine mentioned that you can approach your friends, your parents, your family, and everyone. But then there may be sources where you can now find grants, grant application. So Mugabo, can you hear me?
Yes, Yvette, I can hear you.
Yeah, so people want to know from you the sources where we can find the grants. And the process, Anyanja work has really talked about the process of writing a grant proposal, like the procedures, but this could be another webinar. I'm going maybe to give feedback to my successor to host this so that we go through a grant proposal. That is the webinar itself. So meanwhile, let's now see what are the sources where I can get the grants application, maybe what makes it withstanding, or where do you find ideas from? Yes, so that we start writing as well. Meanwhile, let us follow Health Research Network. It is an initiative by Adamo Aisha. So let's also support him. Thank you, Mugabo. Anyone with a question can also type it in the comment because we are running out of time now. You're welcome, Mugabo.
Okay, thank you, Yvette. First of all, I will go short because of time, but I can say that grants are everywhere, but we need to go strategically so that we can find them. There is Twitter, there is LinkedIn. To get grants from there, it's better that you follow people whom you have the same vision and mission. For example, if my work is about supporting girls' education, you can see some organizations that work on the same cause on social media, either Twitter, LinkedIn, and then you follow them. Sometimes, if those are big organizations, they can give grants, they can announce grants on their websites. But there are also other specialized website that is their only work. It is just posting grants, and the challenge of this grants are generalized. They can post grants in education, they can post grants in health, geography, climate change. So there is everything there, but you need to sort what grants that I need to apply basing on my work. Because for me, if I work on health-related things, I cannot go ahead and apply things in climate change because even designing such idea for me, it will be very challenging. But if I work for health, I need to understand my vision. I need to understand what I want to achieve in my community and have some ideas in my mind. Sometimes you can see a grant that fit in your idea and then you can apply for it. The website that I can mention right now, one is Funds for NGOs. It is
What?
a very big.
Can you give us the link in the chat? Give us the link in the chat. Just
Okay,
type it.
let me Google it and then I share the link. One is stands for NGO. This one has a lot of grants that are given for NGO across the world. What you need to do is to make sure that you are fitting the eligibility criteria because some grants may be for people across Africa or across Europe. So if it is in Africa and you're based in Africa, that's great for you. I have shared the link. It is stands for NGOs, their website, and another big website. It is very popular. It is called Opportunity Desk. This posts internship. This posts also grants. I will also try to share the links in the chat so that people can access them easily because it can be hard to memorize them right away. Okay.
Yes, try. We want you to type them in the chat, so that we can all see them.
Yeah,
Yeah.
I'm sharing them
And
in
tell us
the
which ones are open now, except the Tony Elumelu. What else is open?
okay.
Yes.
Yeah, another one. Let me try to look for another one on Google. Okay, for people based in Africa, there is another one called Africa Development Foundation. That is very specific to Africans and provide a lot of grants to health-related activities. So, okay. Yeah, so there are a lot of websites where we can have a grant, but the biggest trick is to know where can I find them. For me specifically, Twitter is a very great platform for me. I do use it frequently, and whenever I see an organization that works in my interest, for example, currently my work focus on antimicrobial resistance, digital health, because most of my work is digital enabled. So I do the best data flow organization in that sector. And when they post grants, when they retweet other opportunities, I can benefit from them as well. Meanwhile, I can share those free websites. And the last one for people who works on TB, malaria, and AIDS, there is Global Funds. But the specific branch of Africa, I also shared the link for that in the chat so that you can access them, and you can try to surf and then see if some grants there are open, and there are also good opportunities for grants. I think as Yvette said, we might organize a webinar on grant writing. I have done almost a few of them, and no one has been WMI. So hosting one for WMI scorers and the graduate scorers would be a great pleasure. Thank you.
Thank you very much, Mugabo. So since you are now out of time, I just want to highlight the points which has actually flipped me. I don't know if you have something to share, you can also share in the comments. So the first thing is to follow people who are very impressive on the website, on different social media accounts, like LinkedIn, on Twitter. Sometimes we find ourselves following our friends, only people who just post things to laugh. But it's also good that we follow people whom we think we share the same vision for, since whenever they post any opportunity, you can actually access them. And there is another good point that Catherine has mentioned, that you don't have to get discouraged. We just have to get a sense of belonging. Like, yes, I'm serving this. I'm a nurse. What can I do next? I'm a pharmacist. What can I do next? I'm a doctor. What can I do next? So, like, I having the sense of belonging. Like, what can I add up to what I'm having now? And everyone can be great because everyone can serve. So the sense of serving is going to bring us opportunities, as happened for Catherine. It's going to bring us money, like for the grants thing of Mugabo, the big boss. It's going to give us community impact. For example, it's going to give us growth, personal growth. And remember, I don't know whether some people were here when we hosted a webinar on choosing, finding scholarship opportunities. Sometimes many of the scholarships, they ask what you have been doing like in the past, right? I think I am right. So when you have done something to impact your community, it is actually good. Like you are able to say it, and then you can pass through other opportunities. So thank you very much, Mugabo, for being with us. Mugabo, can you hear me?
I can hear you well.
Yes, thank you very much. Thank you very much, Catherine, for being with us today. Can you hear me, Catherine?
Yes, Dr. Yvette, thank you.
Yes, so thank you very much, Alfred Kwitonda, Abigail, Aisha, Anyanja, Ainaitwe, Bangura, Betty, Charity, David, Fortune, Frank, Kasim, Gabriel, Bandeng, John, Maikudi, Mori, Onezai, Precious, Anyacho, Sylvia, Victorina, Yusuf, Cassidy, and some of you who have actually left. So thank you very much for being with us. For those who have joined late, you can access this on the YouTube. It's going to be shared on the YouTube of WMI Monday as a recording. So if you missed the first part, and if, for example, you have missed it all, you are always welcome to check on these webinars, since they are published there. And don't remember to subscribe. So we can say bye in the comments as we leave. So thank you very much. As my last webinar during my mandate, I want to thank you for being with me. It has been a very good journey. I've never hosted a webinar and missed people to attend. So it's been very good friends and supported my work. I've been sending invitations, sorry for my stressing emails, to ensure that you at least participate. So I'm very thankful that we managed to be together into this, and I hope that it has added on something. So we look forward to have our successors in February, and we are hoping that you're going to be among them. You're going to be one of the successors to join the WMI Scholar Board. So thank you very much, everyone. Have a nice day. To those ones who applied, nice evening according to your time zone. See you on YouTube now. Thank you very much. Have a good day. Yes, bye. Bye, Alfred. Bye, John. Bye, Kasim. Bye, David. Bye, Precious. Yes, bye, everyone. And thank you for being with us. Yes, bye.